everyone, this video is about the different forms of medication preparation. I am Jenlyn Bernard, working as tutor in MMM College of Nursing. This video will help you to understand about the different sources of medication and also the different forms of medication preparation. The drugs are prepared through different sources like plants, animals, minerals, microbiological sources, synthetic and semi-synthetic agents, and also by using the recombinant DNA technology. According to the physical forms of the medication, it can be classified as solid, semi-solid, liquid, gaseous agents, and also the sterile products. The solid forms of medications can be used for the internal usage as well as external usage. They are powders, tablets, caplets, capsules, catechs, pills, lozenges, pastilles, granules, medications used for insufflation, dentifrices, and dusting powders. In similar way, the semi-solid form of medications also can be used for internal use or the external use. Like gels and jellies are used for internal uses, and external uses ointments, creams, paste, gels, suppositories, pessaries, poultices, and paints. The most common form of liquid medicine which is used for the internal usage is solution, suspension, emulsion, elixir, syrup, collodion, mixture, draught, and drop. The liquid form of medication which is used for external usage is irrigation solution, lotion, liniments, mouthwashes, nasal, ear and eye drops, enema, sprays, and also the gargling solution. The gaseous form of medications are used as aerosols and sprays, and which is used with the method of inhalation and insufflation. The medications which can be used for these sterile procedures are in the form of injection. It will come as the liquid as well as the powder, infusion fluids, ophthalmic preparations, and also drops. There is a novel drug delivery system. Novel drug delivery system is a method of delivering medication to the patient in a manner that increases the concentration of the medication in some parts of the body relative to others. This means of delivery is largely founded on nanomedicine, which plans to employ nanoparticles medicated drug delivery in order to combat the downfall of conventional drug delivery. Powder is the solid form of medication. It is a finely grounded drug or drugs. Some are used for the internal usage and few are used for the external purposes. Under solid forms of medication, the tablets are available. Tablet is a powder drug compressed into a small hard disc. Some are readily broken along a scored line. Others are entry-coated to prevent them from dissolving in the stomach. Entry-coated tablets. Entry coating is a polymer applied to oral medication. It prevents the gastric acid in the stomach from dissolving or degrading drugs after swallowed them. Without full enteric protection, many drugs would fall apart rapidly in stomach acid. The coating creates a delayed release for various dosage forms. Sustained release medication. These are more potent drugs dissolved slowly and release small amount of medicine into the patient system over an extended period of time. It is also called as controlled release formulation. Caplets are the forms of solid medication. A solid form shaped like a capsule, coated and easily swallowed by the patient. Capsules are the gelatinous containers to hold a medicine in the powder, liquid or oil form. Once it is swallowed, the gelatinous capsule will be dissolved and release the medicine into the gastrointestinal tract. Catechs are a kind of wafer capsule formerly used for presenting unpleasant tasting drugs. Pills is also a form of solid medication. In pills, one or more drugs mixed with a cohesive material in oval, round or flattened shape. Lozenges. It is a flattened, round or oval preparation that dissolves and releases a drug when held in the mouth. Pastilles. It is a hard jelly-like preparation made from a mixture of glycerin and gelatin with a medicine, in which color or flavor may be added according to the need. Granules is a type of solid medication. The granules are a small, fine or corrosive particles are converted into large agglomerative commonly used in tablets and capsules. Example, methylcellulose. Dentifrices. Dentifrices are the agents used with toothbrush to clean and polish the teeth, which include toothpaste and tooth powders. There are medicated toothpastes are available, which is helping to treat the sensitive teeth and also to treat the gum conditions. Semi-solid forms of medication. Gel or jellies are coming under the semi-solid preparation. It is a clear or translucent semi-solid that liquefies when applied to the skin. Ointments. Ointments are a semi-solid preparation of one or more drugs used for application to the skin and mucous membrane. Cream. A non-greasy semi-solid preparation commonly used to treat the skin condition. There are some difference between cream and ointment. Cream is a water-based preparation, but ointment is a oil-based one. Cream usually non-greasy in nature, but ointments are greasy in nature. The consistency of cream is thick, but ointment is thin. The creams can be absorbed rapidly, thus causes the rapid onset of action. But the ointments will be absorbed slowly, which leads to the slow onset of action. The creams can be washed very easily, but ointments cannot be washed off very easily. Usually the creams are white or half white in color, and ointments commonly in translucent nature. Paste is a preparation like an ointment but thicker and stiff that penetrates skin less than an ointment. Suppository. It is a semi-solid preparation. In this, one or several drugs mixed with a firm base such as gelatin and shaped for insertion into the body, especially into the rectum. The base dissolves gradually at body temperature and releasing the medication. Pessaries. A pessary is a prosthetic device can be inserted into the vagina to support its internal structure. It's often used in case of urinary incontinence and a vaginal or pelvic organ prolapse. Also, it is used for local application of medication into vagina and also for the contraceptive purpose. Poultice. It is a soft substance that can be spread on a cloth and put on the skin to reduce pain or swelling. It is a method of traditional treatment. Now we can see the liquid preparation of medication. Aqueous solution. In this, one or more drugs will be dissolved in water. Aqueous suspension. In this, one or more drugs finely divided in a liquid such as water. In this, when the containers are at rest, we can able to see the medicated particles has been settled at the bottom of container. So we need to be cautious to shake the containers very well before the usage of medication. Paints. Paints are a viscous liquid preparation used for mouth and throat infections. Glycerin is commonly used as a base because being viscous, it adheres to mucous membrane for a long period. Glycerin prolongs the action of medication. Glycerin also provides a sweet taste for preparation. Also, the preparations for skin used for anti-inflammatory purpose like eskemethyl glycerin. Emulsion. Basically, it consists of a dispersion of two liquids that are immiscible with each other. One of the liquids acts as a dispersant medium and the other will act as the dispersed phase. In simple, emulsions are colloids in which both the dispersed phase and dispersion medium are liquid. Elixir. It is a sweetened and aromatic solution of alcohol and water used as a vehicle for medicinal agents. Syrup. It is an aqueous solution of sugar often used to diffuse unpleasant tasting drugs. Collodion. It is a flammable syrupy solution of nitrocellulose in ether and alcohol. There are two basic types, flexible and non-flexible. Flexible type is often used as a surgical dressing or to hold dressing in place. When painted on the skin, collodion dries to form a flexible nitrocellulose film. Mixtures or liquid oral preparation consisting of one or more medication dissolved, suspended or diffused and aqueous vehicle. They are usually freshly or recently prepared and are used quickly, usually within a month for short-term therapy like cough, diarrhea and constipation. Drops. These are used to describe liquid oral preparations which contain only one or two large doses. Drops. Drops are any liquid medication administered by using the dropper. The oral drops are available for the newborn babies which facilitate to administer the very less dosage of medication according to the need of the infant. The other liquid form of drops preparation is used to administer medication to the ear, eyes and nose in the form of eye, ear and nasal drops. Irrigation solution. Irrigation is bathing or washing out a body part, cavity or wound with water or a medicated fluid. Very commonly, the sterile normal saline is used to do the irrigation. In lotion, a medication in a liquid suspension applied to the skin. Very commonly, the lotions are used only for the external application. Liniment. A medication mixed with alcohol, oil or soapy emollient and applied to the skin. Mouthwash solution. Mouthwash is a liquid solution for rinsing and cleaning the mouth. A liquid mouthwash is often used in dental hygiene. The antiseptic medications also used as the mouthwash. Enema. A liquid used to administer through the rectum for cleaning or medicative purpose. A spray is a dynamic collection of drops dispersed in a gas. The sprays are available to treat the conditions which is related to muscle pain, skin conditions and throat related conditions. Gargling solutions are used to wash or medicate the mouth and throat by filling mouth with a liquid, tipping head back and using throat to force air through the liquid and finally spitting it out. Tinctures are the liquid preparation. It is prepared with an alcoholic or water and alcohol solution prepared from the drugs derived from plants. Aerosol medications are in the gaseous form. A jet of liquid in fine drops coarser than a vapor. It is produced by forcing the liquid from the minute opening of an atomizer, mixing it with air. inhalation. The drugs for inhalation are in liquid and powdered form, requires a device for delivery. There are three main types are available: dry powdered inhaler, pressurized meter dose inhalers and nebulizers. All are designed to produce an aerosol for delivery of medicine into the lung. Insufflation is the act of blowing the medication into the body cavity. The medication may be in the form of powder, vapor or gas. Sterile preparation of medications are used to inject the medication directly into the body. This sterile solutions or liquids are the preparation that contains water with one or more dissolved compound of medication within that. The sterile medication for injections are also available in the form of powders. This has to be dissolved in the sterile solution before the administration. Infusion fluids or medicines are the sterile preparations. In this, the medicine or fluid will be introduced into the bloodstream in the larger amount. Intraocular disc. The medicated disc that is inserted into the patient's eyes, which is absorbed over a period of time. Transdermal patches. These are a semi-permeable membrane shaped in a form of a disc or patch that contains a drug to be absorbed through the skin over a long period of time. In this session, we have learned about the different sources of drug preparation and also the different forms of drug preparation and its common route of administration. The contents were taken from the Nursing Foundation textbooks and also from the internet references. I hope this video was useful.